Yes, we can hear you.
Okay, thank you. So thank you very much for the invitation, and if you could put up my first slide, it would be excellent.
Sayın Petersen'in sunumunu açabilir miyiz arkadaşlar? Teşekkür ediyorum.
Thank you very much. So I would like to highlight that one of the most important things I'm doing right now is to chair the ESMID Emerging Infections Task Force. And we are putting out newsletters to give some important news to ESMID members about the COVID pandemic, especially. And for instance, yesterday we posted a news items about that you need to be a little bit careful about a false vaccine booster. So I urge you, if you're not a member of ECMID, become a member and sign up for our newsletters. So this is my second slide, and I'm just pointing out that we have an awful lot of virus out there that we don't know anything about. And that is important to realize that, in my view, it is not possible to predict what is the next pandemic virus, where does it come from, and what will it be. But we'll see. So next slide, please. Next slide, please. Yeah. So since 1940, there have been 335 new human pathogens, and 60% of these are zoonotic. So new infections are coming from animals and crossing over to humans, and perhaps one of the most important one in the past 40 years is HIV, the human immunodeficiency virus, which is definitely probably a chimpanzee virus which crossed over to humans. Next slide, please. So what is driving the spread of infections, and especially new infections? Well, we have crowding. In some areas of Hong Kong, you have 50,000 people living in 1 square kilometer. We have close animal-human contacts, and this is one of the key focus on my talk. That's where we need to focus surveillance for new infections. And also the COVID-19, the SARS-CoV-2, probably originated by close animal-to-human contacts in the Wuhan wet market. Then we have mobility. Bugs, previous one, please. Bugs are traveling with people, and the people are traveling. Previous one. People are traveling a lot. We have migration, we have refugees. Then centralized food production. We have had some outbreaks, especially in North America, in the United States, of Salmonella or Cyclospora, which is spreading to many states because they are introduced into the food in a single manufacturing plant. Then we are getting older, and our immune system are not as good as it were when we were 40 years younger. We have more immunocompromised patients. Just think about new biological drugs. When you have an autoimmune disease, you have war. Just think of what is happening in Yemen, and that is an excellent condition where all the control of infectious diseases are breaking down, and the infections like leishmania is spreading. And of course, with the climate change, we'll have a change in vector distribution and vector susceptibility. Next one, please. And this is just a picture from West Africa about what they call the bush meat, and this is how we think that HIV crossed into humans because they are slaughtering and hunting wildlife. And then, of course, if you slaughter a wild animal and you get blood on you, you can also transfer a virus. Next one, please. So this is another example. This is the Avian H7N9 virus, and this is outbreaks in China. This is spreading in poultry markets. There's almost no human-to-human transmission, but this just shows you that very close contract on poultry markets between humans who is buying chickens, and you have an enormous amount of chickens on these markets, will give you a transmission from animals to humans. And we cannot predict if this has a pandemic, a human pandemic. When will it start to be transmitted between humans only? We don't know, and we cannot predict it. Next one. Being a zoonotic disease, it's important to realize that the virus may disappear into animals and surface years later. This is an analysis of what happened with the pandemic influenza in 2009, where you could actually track it back to the Spanish flu in 1918. And you can see here that the 1918 virus, of course, it became a seasonal influenza virus up to the next pandemic in 1958, but it also moved into animals. So you had an avian reservoir, you have a swine reservoir, and you probably also have some bird reservoirs. And then when it surfaced in 2009, you could say, okay, there was some part of it that were new, but it was actually also part of the original 1918 virus. And this is what might happen with the SARS-CoV-2 virus. Also, we already have some reports that it may be able to go into rodents, or we have white-tailed deers in the United States, and half of them have COVID virus. So the fact that this is a zoonotic virus means that even when the Omicron wave is over, this is not going to disappear. There will be new virus. It may disappear. It goes into the zoonotic reservoir, and then it may come back. Next one, please. Yeah, and that's what I just said. Yes, why not? And we have to think about that. This is a zoonotic virus, so it cannot be eradicated. We have to live with it. Next one, please. And we had quite an experience in Denmark in June to November 2020, where COVID moved into mink. We had, at that time, we had 17 million mink that was farmed to make furs, and they got COVID. And as you can see, this is on the left side, it's a mink COVID, and on the right side with a red map, you can see this was human cases that were infected from mink. And we found that the COVID virus could move from mink to humans, and from humans and back to mink. So the only way we could control it was that we killed all 17 million minks, and the mink business is simply completely closed. But it just illustrates that if you have very close contact between humans and you have a high density of animals, then you have the potential for transmitting zoonotic virus to humans and back again. Yeah, next one, please. So the rest of my talk will be on coronavirus, and I don't think I need to tell you what the spike protein is. So we'll move to the next slide. So I will just briefly recapitulate what happened in 2003, where this was the 10th of February, where we in ProMed had the first English language report about an unknown pneumonia in Guangdong province in China. Next one. And that turned out to be the SARS-1. And you can see that it took 6 weeks until the 25th of March before we knew what virus it was. But after that, the diagnostics moved very rapidly. But that was about nearly 15 years ago, and the technology is much more advanced these days. Next one. This is the final epidemic curve of SARS-CoV-1. And it was simply over in 6 months, and it disappeared, and we haven't seen it since from wildlife. We don't really know where it came from. It's no doubt that it is originally a bat virus, and then you had an intermediate host, and exactly what that was, we don't know. But the difference between SARS-CoV-1 and 2 is that the peak excretion of virus with SARS-CoV-1 is on day 4. So you fall ill and then you have time to be isolated in quarantine before you are very contagious. In SARS-CoV-2, you excrete a lot of virus when you fall ill. So quarantining early does not help. Next one. So we moved up to 2012. And now we have a new coronavirus in Saudi Arabia. Next one. And this is a MERS virus, the Middle East Respiratory Syndrome virus. And you can see that you had a focus in, especially in eastern part of Saudi Arabia, and cases were exported to countries in Europe. So again, this was a new coronavirus. Next one. And the reservoir was a camel as an intermediate host, but it also originated in bats. And the Saudi Arabian have a very intimate relationship with their camels, so there was close contact between camels and humans, and then it spilled into the hospital. So a major part of the spread in the beginning was nosocomial. The MERS virus do not have a high reproductive number, so just as we know now, it doesn't have a pandemic potential. It's now almost 10 years since it was isolated, and there's no sign that it will become a pandemic. But it just illustrates that coronaviruses originating from bats have the potential to move into humans via an intermediate host. Next one. And now we are coming up to the 30th of December, where there was again in the ProMed a news piece about a unknown pneumonia, which was seen in December in Wuhan. Next one. And now we are almost 20 years after SARS-CoV-1, and things goes much quicker. So already on the 10th of January, we have the first full genome deposited in GenBank. And that was really thanks to this Professor Zhang from China. And as far as I know, he didn't really get a permission from the Chinese government to make this sequence public, but he did it. And that was of immense importance, because open science is what allow companies to use the sequence to develop diagnostics and treatment and vaccines. Next one. So you can see this is a genomic tree. Here at the bottom, you have the Middle East Respiratory Syndrome. At the top, you have the 2003 SARS, and in the middle, you have the 2019 COVID. So this is a new coronavirus, which is not really closely related to the other two viruses. Next one. So already on the 25th of January, we had 28 full genome sequencing, and an analysis of these sequences concluded that there was a human and animal to human crossover at some stage, but all later transmissions were human to human. There's been a lot of talk about where do it come from, and there was been this talks about that the virus originated in the Wuhan Institute of Virology and so on. But really, this is a very nice study I can recommend you from Cell in August 2021, where they went through all the molecular data, and they strongly conclude that this is an zoonotic virus. It's not an engineered virus. It's a zoonotic virus that has crossed into humans. Next one. So how did it happen? Well, this is a very nice report of some Chinese scientists who tracked animals available on sale at the Wuhan market. And he looked at these for 2 years, from 2017 to 19, and he said there was they sold 47,000 animals from 38 species, and 31 of the species was protected species. So you had a huge concentration of animals, you have a lot of different animals, and you had close contact with humans. Next one. So some of these animals were hunted from the wild, but in China you also have farms that are growing animals, for instance, the dogs, which they are eating. So, and all these animals were sort of concentrated in these wet markets. Next one. And you can see this is a picture from this study. You can see how the animals are very close. They're probably on top of each other. So if you have an animal in the top, a cage that are excreting virus and feces, it will drop down to the animals further down, and then it will be contaminated with the virus. And when the humans buy these animals and it's slaughtered, you will be exposed to the virus. So this is also a strong, what shall I say, indication that this is a animal to human event, and it's not an engineered virus. It's simply because we are very close to yeah, I think you have to take the next one. Yeah, we have this one, so to take the next one, yeah, and the next one, yeah. So this is my last slide, and the conclusion is that you cannot predict what, when, and where things will happen. The influenza pandemic in 2009 originated in Mexico because you had a very high concentration of pigs there, and that was completely unexpected. And most emerging infections are zoonotic. We must focus when we do surveillance in the future on places where animals are in large numbers, like in our mink farms, where you had 1,000 of animals in a very close space, and you had humans who took care of them. That could be, for instance, poultry farms in China. It could be pig farms in Europe. Whenever you have a lot of animals indoors and you have the humans to take care of them, that's where we have to do the surveillance. Pigs, goats, and poultry, the One Health approach is of tremendous importance. And we have to use metagenomics because we don't know what we're looking for. So we have an unbiased approach using metagenomics to say, okay, if we have an animal who is not ill, we should also go to the caretaker, say, do we have some of the people taking care of the animals who are sneezing, who are coughing, who perhaps, so we do look both at the animals and the humans who are in close contact with them. And this needs to be a public funded part of routine public health. It's not something we can do by research funding because it needs to be ongoing. We need to have sentinel sites where we do this surveillance routinely. It needs to be on the budget of the governments in close collaboration with the WHO and the OIE, who is the animal equivalent to the WHO. So this is, I think the next one is my last slide. So I will just say thank you very much. And I really enjoyed meeting you all tonight.
Thank you very much, Professor Petersen, for this nice speech. Teşekkür ediyoruz Sayın Profesör Doktor Eskild Petersen'e. Gerçekten tek sağlık konseptinin ülkemizde de tartışıldığı yıllardayız ama bunun ne kadar önemli olduğunu tabii çerçevesinin ve işleyişinin belirlenmesi şartıyla hakikaten uygulanabilirliğini de sorguladığımız zamanlardayız. Doğru kurgulandığı zaman tek sağlık konseptinin de çok yararlı sonuçlar elde edeceğini bu pandemide de aslında görmüş olduk.